expanding on the already laid down protocol. So what do we intend to do with health? For us, the most basic and the most foundational thing that is required to do is first of all making government work. The basic problem right now is that government and government institutions are dysfunctional. They are not working together. We can hear from what the executive secretary said earlier, that it's just now that some of these institutions are beginning to work together. So the basic thing is that government institutions must work and must work in synergy. The second thing that is primary for us is that health, like every other basic welfare service in education, housing, energy, power, food and nutrition, should be delivered primarily as public services. Meaning that government and the public sector must play the leading role in the delivery of these public services, these basic services that are now public services. So what this means is that health and education must be a priority of any government. And it therefore means also that public investment must also be directed towards provisioning these public services. Now, having said that, if you look at the National Health Act, and we don't really lack policies in this country. Part of the challenges is about making the policies work and ensuring that they work together. If you look at the National Health Act and the National Health Insurance Scheme, we have given responsibilities to different tiers of administration, including communities. Now, this is why I said that governance matters, including communities. But we also have a situation where we are putting responsibilities on communities, on education, on health, housing, and yet our communities really have no formal governance systems. So we want to set up a community or world health development committee that has to rely on reaching out to a legislator somewhere. Whereas there are basic things, primary healthcare issues that communities can handle themselves if they were properly governed and if there was formal community governance. There is also this issue that we all, that everybody wants to hear about, which is the question of what percentage are you going to devote to health? And let me be very clear about this. The problem with the way in which we are going about these percentages is the absence of planning. Because if you plan and you plan well and you have an integrated plan, if you look at all of the 6 core areas of healthcare management and delivery system, personnel training is part of it. Equipment and medical products is part of it. Okay, so what does this tell you? It means that there are education issues in health. There are health issues in education. There are food and nutrition issues in health. There are agricultural issues in health, health issues in agriculture. So if you had a comprehensive national human development plan with your priorities, then it means that you can, and your funding, your investment is also targeted towards making and implementing your plan. Then you are going to be able to cut all of this. Because then you can find, when you look at the education budget, you can find sections of it that are devoted to education in health. You can find sections of it that will be devoted to education for agriculture. You can find sections of it that will be devoted to education, for manufacturing, for industrialization, and the rest of that. And when you also look at your health budget, we also find sections of it that will be devoted to, for example, pharmaceutical manufacturing, and the rest of that. So it's when you have such an integrated plan that actually the quantum of money that you invest can have qualitative impact. And that is more important than the actual amount and figures, you know, that we that are going to be spent. So it is more important to have a national and human development plan. And I commit that within the first 100 days, we are going to have a 4-year national human development plan for Nigeria, for the administration. I also know, and it's going to be that integrated. It's going to also include the necessity to reform governance and to retool governance, to retool the state to deliver effective public services. Within the context of this National Human Development Plan would also be the National Health Care Plan. And what will the National Health Care Plan do? The first thing that we should actually even do as a government within the first 400 days is to do an assessment of where we are at the moment with everything, all of these laws that we are going, that is now going to fall on us to implement, to execute as the executive. Where are we at? What is the status in terms of implementation of policies, of laws, and the rest of that? And then, on the basis of that, develop your plan and your priorities, and also on the basis of that, develop your investment plan so that you can actually direct public investments to what is necessary. Let me tell you one other thing. So it is important that, for example, and also this debate about whether we are going to concentrate on primary health care or secondary health care or tertiary health care, or whether we are going to concentrate on preventive health care or curative health care, is really, shouldn't be a mutually exclusive debate. The most important thing to understand is to find out what percentage of healthcare delivery needs to be for primary healthcare, needs to be for secondary healthcare, needs to be for tertiary healthcare, and what percentage needs to be for preventive. Because we would concentrate on preventive, but you also know that there would be necessity for curative. So you cannot say that you are going to, your policy is just preventive and it's not going to be curative. So it's going to be both preventive and curative. It's going to be address primary, secondary, and tertiary health care, but it's going to be on the basis of needs assessment so that we know that this is actually the proportion of the population that needs each one of these type of healthcare delivery. And then finally, just to round up, because I know there will be time for questions. When I talk about the necessity for having an integrated plan, so we are going to focus, for example, on local and indigenous production of equipment and medical products, which means that our health policy must also be integrated with our industrialization policies, and that it must be also integrated with all these other policies, because it is those indigenous Nigerian industries that are also going to be the ones to manufacture these health products and the health equipment that we need, and same with the training of the personnel that is needed. Finally, what we need is to have an idea of what the specifics are within the context of the whole picture, and then be able to plan to address both the whole picture and the specifics. Thank you very much.